So this research was really driven by a couple of pressing challenges faced by countries and societies across the world, right? So everywhere we see countries struggling with worsening public health trends, as well as rising costs of healthcare, right? So and at the same time, we all know here that physical activity is a proven solution, and that professionally guided exercise programs and services that the fitness industry provides at scale plays a critical role, right, at reducing chronic disease risks. So the key question for us then became, how can we encourage more people to engage with the industry, right, to help reverse this physical inactivity crisis? And we know from prior research that many consumers cite cost as one of the most important barriers preventing them from engaging with structured exercise. But affordability, right, is not something that the industry can solve on its own. We know that many gyms operate on tight margins, making kind of price reductions difficult without any external support. Like that could risk more closures and really reducing access rather than expanding it. So consequently, we also know that we know that government support is needed to address the question of affordability. But when we talk with governments, it's not enough to highlight the health benefits of exercise. Like we know that we need to present a strong return on investment case to them, right? Like policymakers need hard data and showing how greater affordability can lead to increased participation, improved health, as well as economic benefits is really key. So this research came about as a way of trying to quantify that relationship and helping make the case for the sort of policies like tax incentives that can help make structured exercise more accessible. Yeah, so this was a very robust piece of research that we pursued. So we, in total, we ended up interviewing more than 11,000 adults across 10 countries of the world, spanning both North America, Europe, the Middle East, and the Asia Pacific region. So that included countries like Spain, but also like Canada, Australia, the United States, Saudi Arabia, among others. And while the process was similar for each country, we ended up creating country-specific reports that provide localized insights while also contributing to sort of a broader global picture of the relationship between price, participation, and public policy. So I would say that one thing that really stood out to me was how consistently affordability ranked as a top barrier. That was the same. We found the same thing across all 10 countries that we looked at, which are very different countries, right? Like they have their fitness markets are in at various levels of maturity. Like some are very new, like Saudi Arabia and Japan, for example, have a very low penetration rates when compared to for example, the US. But across all of them, we did see that affordability and the concern around cost ranks as a top barrier to entry for those who are currently not customers of the industry, right? So on average, looking across all 10 markets, 61% of these non-customers cited cost as a major reason why they're not joining. Also striking to me was how already a hypothetical 10% reduction in the price of membership or packages could really affect a significant impact on participation. again, across the 10 countries here, we saw on average a 14% of non-customers for whom cost was a leading barrier, could be motivated to join already at the 10% discount. Yeah, so for the European portion of the research, we looked at 3 countries, right? So we looked at Ireland, Germany, and Spain. And in Spain, as in the other 9 countries in the study, we focused on answering 3 main questions, right? So first, are customers of gyms and other fitness facilities more active, more satisfied, and compared to those who are not customers? And secondly, we wanted to find out if price reductions could significantly increase participation. And thirdly, we wanted to find out the broader societal benefits related to both health, social, and as well as economic gains that could result from increased engagement. So looking at the first question, right? So the data, the survey we conducted, clearly showed that in Spain, fitness facility users are nearly 40% more likely to meet WHO physical activity guidelines compared to non-customers. So that is, if you're a member, you're 40% more likely to achieve at least 150 minutes of physical exercise each week. And also beyond the purely kind of physical benefits, looking at the more mental well-being, we also found that Spanish customers of fitness report higher life satisfaction and as well as greater trust in their communities, really reinforcing the broader social value of structured exercise. But as with the other countries, cost again remained a major barrier here. So 45% of Spaniards who are not currently gym customers cited affordability as a top reason preventing them from joining. So that's a clear opportunity for public policy to help remove this barrier and expand access. So the second part of the research then was this price elasticity study, where we asked these non-customers at different levels of price reductions, would you be motivated to join? And already at the 10% level, we found that this could attract up to 2.7 million additional Spanish adults to join fitness facilities. And while deeper discounts might drive further uptake, the data shows that diminishing returns beyond the 10% threshold, making it really a sweet spot and an optimal balance of investment and impact. And then thirdly, right, so then we wanted to quantify what societal impacts could stem from this level of price reduction. So we found that over like the increase in participation that you could see from a 10% reduction could result in nearly 100,000 cases of disease annually in Spain, and it could avoid over 500 premature deaths each year. Economically, these health improvements could lead to 680 million euros in annual healthcare savings. And beyond that, it could also generate 1.4 billion in additional consumer spending and create nearly 30,000 new jobs. So all in all, this really makes a strong case for government action, that a relatively small investment from the public sector in affordability could yield major public health gains and significant economic impact. Yeah. So as part of this price elasticity analysis, we tested a range of potential price points, but 10% really stood out as a threshold that struck this balance between achieving meaningful impact as well as being financially feasible. So it's a level that could realistically be achieved through targeted government support, like tax incentives, tax deductions, or tax credits, or other forms of subsidies. And importantly, our research shows that these small adjustments could have an outsized effect on participation. As mentioned before, like we saw across the board, across these 10 very different countries and very different markets, that 10% was the sweet spot. So that's why we focused on that through the rest of the analysis. In terms of exactly like what sort of policy vehicle you use to achieve these price reductions can vary between countries, and you can, for the end user, for the consumer, you can achieve a price reduction, from income tax deductions, or from incentivizing employers to provide these sorts of wellness support for their employees, or you can reduce sales tax or VATs for the fitness industry, that which is reductions that they in turn can pass on to the consumer. So we don't recommend a sweeping policy recommendation per se. That is up to kind of local conditions in each country. Absolutely. So we've seen in recent years a number of countries taking steps towards implementing these sorts of smart public policy and common sense public policy to bring down the cost of structured exercise. And the US is one of those cases. So here we're currently working with partners to advance legislation like something called the FIT Act, which stands for the Personal Health Investment Today Act. And this piece of legislation would allow Americans to use pre-tax dollars to cover fitness expenses. So things like gym membership, fitness classes, and youth sport fees could be paid for with these dollars that you set aside before the government tax you on them. So currently, there are kind of programs that allows you to use this sort of money to pay for other medical expenses. But we want to expand this, recognizing that physical exercise is an integral part of the healthcare continuum, and physical exercise is really, preventative healthcare. It is important that people, Americans, have the opportunity to engage with the exercises in the same ways that they can kind of support their access to other medical treatments. And just last week, actually, a bipartisan group of U.S. lawmakers reintroduced this act in the U.S. Congress, and it's now right now working its way through the budgetary reconciliation process. And we're hoping to get it across the finish line. But US isn't the only example, right? Like just north of the border from us in Canada, there is a push from our partners up there, the FIC, the group leading the industry there, to get through a revision of the Canadian tax code to make gym memberships and other fitness expenses eligible medical expenses, which again would bring down the cost of those. And it's not just in North America, right? So like in Europe, there are examples of governments that have been leading the charge with these types of smart policies. So a decade ago, Malta, for example, reduced the VAT rates for things like gym memberships from 18 to 12%, where it is today. And maybe one of the best example is Sweden, which is happens to be my home country, which already in the late 80s implemented a policy that allows employers to offer a tax-free wellness allowance that employees can use on various forms of exercise expenses. And while not the only explanation, it is worth noting that Sweden for a long time has kind of led the world in terms of physical activity levels, as well as penetration of fitness memberships. So, this research is really meant to be used when talking to governments, right, and present this data. It's it doesn't tell individual gym owners or operators to single-handedly like reduce their prices by 10%. We know that would not be sustainable for a lot of businesses. But I think where there is opportunities for collaborations and for the industry itself to be involved is when it comes to kind of partnering with public health campaigns and offering data and insights that can help designing inclusive programs. But most importantly, I think is the industry needs to engage in advocacy, which we haven't always been great at. But this research gives industry leaders and individual operators, right, the data they need to speak with a unified voice and say to policymakers, like, we can help solve this physical inactivity crisis, but we need the support of governments to make it happen and to increase accessibility for everyone. So first of all, like we're continuing to expand our research across new regions and working closely with national groups to help translate data into actionable policy. So we're still, this price elasticity research that we're discussing today was released in January, and we're currently working with local groups and federations to make sure that the messages and the data here really reaches the people who it really matters for. So policymakers and other leading stakeholders. While the findings and the trends that we identify in the data are really global, like policy is still local. So it's important to get this to raise awareness about the connection between physical activity, price, and public policy, right? So that's kind of high up on our agenda, and the ultimate goal is to ensure that fitness is affordable, accessible, and becomes recognized as a pillar of public health worldwide.